Thank you so much for such a lovely introduction. Welcome, everybody. I'm so excited about today's presentation, Cultivating Youth Mattering, Building Community Connectedness. And I want to say that we're going to be talking about youth today, but mattering, feeling like you matter, feeling like you belong is a large-scale issue that faces people of all ages. But today we're going to focus on youth, and it is my distinct pleasure to introduce Kini-Ana Tinkham is the Executive Director of the Maine Resilience Building Network, and we'll have more information about that later in the program. MRBN's mission is to increase understanding of the impacts of early adversity and other factors affecting people's optimal well-being, and to advocate for building resilience through factors such as positive relationships and supportive communities. Kini has worked in public health and healthcare, and do you mind me saying, for more than 40 years. She's worked as a nurse, as an educator, as an advocate, as a leader, as a trailblazer, if I'm just going to add that in here. So please join me in welcoming Kini, and I'm going to pass it on to you.
Yeah, thank you for the kind introduction. Welcome, everyone. As we settle in and begin to learn together, I'm grateful to be here today. Again, I'm from the Maine Resilience Building Network. So currently we're fighting an epidemic and opioid misuse crisis in our state, including suicide, and we have spiking levels of depression and anxiety in Maine. In fact, Maine is ranked for youth anxiety as #1 and depression of #3 in the country. Public health approaches inform us that if we want to solve these issues, we need to go way upstream, look way upstream and focus on primary prevention. So we can sit at the bottom of the stream instead and focus on creating a sense of problems, or we can go way upstream and instead focus on creating belonging and sense of community that will help us heal and create mattering for youth, reducing risk for depression, anxiety, and substance use and misuse. So before we move further, it's important for me to just talk a little bit and define mattering for you. So mattering is the work of Dr. Gordon Flett, and he shares with us through his research that mattering is a sense of being significant and valued by other people. So people who believe that they matter to others have a key protective resource that can buffer them from life stressors and challenges throughout their life. Mattering is a protective factor for handling challenges through life transitions that so many of us experience during adolescence and again into adulthood. We know that mattering is strongly connected to the protective factor of social connectedness recognized by the US CDC, National Center for Chronic Disease Prevention and Health Promotion, as one of the 5 priority social determinants of health that can impact health and health equity. Social connectedness is the degree of which people or groups of individuals have and perceive a desired number, quality and diversity of relationships that create a sense of belonging and being cared for, valued and supported. So for youth, the US CDC indicates that connectedness refers to a sense of being cared for and supported and belonging, and it can be centered on the feeling of connected to both school, family, and again, community, right? And with other important people in organizations in their lives. Youth who feel connected at home and at school are less likely to experience negative health outcomes related to sexual risk, substance use, violence, and mental health. And we'll talk more about that later. Recent CDC findings published in the pediatric journal remind us about this new study. Next, I'd like to talk about the domains. Mattering is not a stagnant factor, meaning that once we feel we matter, it translates into every part of our lives. We actually can feel a different sense of mattering in each of the domains noted here, being at home, school or work, and in community. We don't always know what is happening and how someone feels at one time in these domains. So it's important for us to ensure that we are creating mattering interactions in each of the spheres of the influences. I'd like to introduce some data for you from 2019 from the Maine Integrated Youth Health Survey. And what we have on the screen today is data reported out by high school students and middle school students who participated in the survey in 2019. And here we have 43% of high school students felt that they did not matter in their communities. And 20% of middle school students have seriously thought about killing themselves. This is alarming data, and the Maine Resilience Building Network have initiated the Cultivating Youth Mattering in Maine initiative to respond to these diseases of despair and alarming rates. I want to also call out important data from the Maine Integrated Youth Health Survey. In Maine, queer and trans youth are also disproportionately experiencing ACEs and less likely to have support in their community. When it comes to mattering, we have already discussed the connection to ACEs, right? But here we can see this information is hitting youth reporting as LGBTQ twice as hard. Only 37% of youth who identified as LGBT believe they matter to their community in comparison with the statewide average of 50%. So again, 37% of youth identifying as LGBT believe they matter in their community compared to 56% statewide. For more support on the issue, we recommend other resources in the state to become more familiar with data and how we can support youth reporting as LGBT in Maine. I'd like to turn our attention on the power of resilience. And we use the research of Dr. Ann Maston, who's been studying resilience for close to 4 decades. And her definition, resilience is the capacity of a system to adapt under difficult circumstances. And to unpack this definition a little bit, so the capacity of a system, so I am a system alone, my family is a system, your school community is a system, our state is a system. So the capacity of a system to be able to adapt under difficult circumstances. In her book here, Ordinary Magic, Ann Maston teaches us and reminds us that resilience can be supported and promoted. There's no one pathway to resilience. So we all can support and promote resilience within ourselves as the system, right? Or our school community as an example, or our community at large, our state. I'd next like to return to the study that I referenced earlier by the US CDC, and these findings were published in the Journal of Pediatrics. And it suggests that youth who feel connected at home and in school were less likely to experience health risk behaviors related to mental health, sexual violence, sexual health, and substance use into adulthood. And this is a survey that was done by adults reflecting back on their youth and having connections in community and school and home. So important that we have this data available to us, and it just underscores the need that youth connectedness has lasting effects well into adulthood. I think we're going to move to breakout rooms now.
We are going to move to breakout rooms, which is really, I'm really excited for this. And because what we really want to do with these rooms this first time around is have you introduce yourselves to each other, because I can see we have someone here from Westfield State, which is so exciting to have folks from other places attending this today. And what we want you to be thinking about is what makes you feel that you matter. Think about a time where you really felt like you belonged, that you were recognized, that you were part of a community. What actions did you see? What qualities were in place? And then to think about what spaces, places, or practices currently exist in your community, including here at the university, that foster connection. And hopefully there'll be someone in your breakout session who's willing to report back to us, because we want to learn from you too. So are we ready to go into breakout rooms?
Want to make sure that the prompts are cut and pasted into the chat before we do that.
Okie dokie.
There
There
we go.
they are. They're there.
All right, we'll have 10 minutes for this one.
Right. Welcome back, everybody. We'll wait for everyone to be in the room. Hi, Tom. Nice to see you. Tom and I just met, so that's why I'm singling you out.
Nice to see you too, Shelley.
Really interesting conversations. So please feel free to put anything in the chat. Those of you who volunteered to sort of be scribes or take notes or whatever, please put some comments in the chat, and we will be noticing them and bringing them forward. I know well, Chris, let me know when we have enough people in the room so that I can start jabbering on.
The rooms are closed, so you are free to go.
Thank you. So I just want to comment on something that I really noticed in our room, and I'm curious whether other folks heard this, which was being checked in on, that people not only noticed when you were there, but noticed when you were gone. And that when you return, people were really interested in, you know, why you were gone and welcomed you being back. And that seemed to be, I don't know, Kenny and I were in the same room together with a student from the medical college, and that was a very common theme. What about others? Did you hear something similar, or what did you hear in your rooms about what were the qualities of feeling like you mattered or you belonged?
In the
I
chat,
think we had a similar thing, but we were talking about the culture of being celebrated, but that still takes that extra effort of someone knowing it's your birthday or knowing that you are expecting a baby or just got engaged or got a promotion. So it's that checking in and then going the extra mile to celebrate that.
And celebration means paying attention, right? Paying attention to other people and the uniqueness of their lives. So you're not just being blended in with the masses, but that they're noticing you. Thank you, Grace. That was great. Thank you. Sarah, I see you have something in the chat. Would you mind lighting up?
Sarah and I were saying really authentic connection matters, and just when you know someone's actively listening to you, even in a small exchange, if there's an agreement that's followed up on, and this kind of concept that you shouldn't have false promises or fake small talk where you make inauthentic connections, like even those small things. Oh, so great to see you. We should get coffee later. Feels like you don't matter. It's small but significant kind of interpersonal interactions.
Yeah, I mean, I think when people break their promises, you tend to lose faith in how others feel and whether you belong or not. I see some nodding heads. Those of you who are lit up, I suspect some of you are eating your lunch, which is fine with us. Kelsey, you've got a lot of stuff in there. Do you want to talk about it, or do you want me to read it off?
It's very timely because I just had a bite of salad. So Raven and I talked about the small moments too, like these big structures matter, and seeing heard and seen in your community, your school, your playground, your after school care center, but also it's opening the door for somebody. It's smiling, it's checking in. How are you doing today? How'd you sleep last night? It can be those little moments to kind of reinforce and acknowledge validation. And then it can also be those larger, more structural supports too.
Great, thank you. I also noticed that you mentioned equity and diversity in the chat, and being inclusive and open to people, no matter who they are, no matter where they come from. Tom, I see you have something in the chat here about impact, which I think is really powerful. Would you like to comment on that?
Sure. I think it's just helpful to be able to feel like you affect the world that you live in a positive way. And because I think to feel as though you are positively received by other people in some way goes a long way in helping to build self-esteem.
Yeah, again, it's impact mattering seem to be analogous. Before we close, I do want to ask about the second part of the questions, which was, what places and spaces here do you feel really conjure up a feeling of mattering and belonging? And if anyone wants to put something in the chat or just light up, please do. Where do you feel you're most comfortable? You know, Sophia said, and I hope she doesn't mind me sharing that when faculty recognize and ask how you as a person are, you know, how you doing before launching into content, that those kinds of classroom spaces feel like you matter. All right, well, let's consider that. And Chris and Kini, are we ready to, thank you, Tom. I feel I matter in the MSW community. What are the qualities that you can articulate maybe that make you feel like you matter before we move to the next section?
That's a good question. Just in class discussions, I feel as though I am really able to participate in engagement with my peers, and it feels really good to be able to learn together by building off of one another's ideas.
So one of our favorite terms in the IPE world is psychological safety. So feeling like you can be yourself, say what you think, say what you feel. Hannah says making a difference are all really important qualities. So thank you all for your feedback. And Kini, would you like to move on?
Thank you. I want to acknowledge the small acts that were noted here. They really do go a long way in just slowing down, right? And how do we support social connectedness, right? Whether it's at school, in community, makes a big impact, these small acts that we've referred to them as. So this is the study that I'd like to introduce to you now that was done in 2004 by a researcher, Janice Whitlock, and she looked at community connectedness, and the results of this study suggest how adults and community can support youth connectedness. In some examples that came up were youth-adult relationships, positive, supportive, quality relationships, belonging in public spaces, youth feeling safe and welcomed in public spaces. And again, thinking about our communities at large and our youth, do they feel connected and have safe spaces to gather? That their power and voice in community affairs, so are they invited to be at the table for decision making when decisions are made that impact them, maybe the school budget as an example, whether or not to stop the late bus as an example, closing the park off at 7 p.m. to no one under the age of 18 can be in this space. Are youth invited? Is their voice part of the decision? And then creative engagement, you know, how do we think outside of making decisions and how we engage in creative ways within community? Further, as we do a deeper dive into mattering and the work that can be done in communities, we can look at these harm reduction strategies as a way to build an individual sense of mattering in community. And I think many of these cross over into adulthood in our world at work and as a student. And I can highlight a few of them here. But again, as someone mentioned earlier, checking in and asking directly about someone's fears, hopes, and interest, you know, aspirations, and reflecting and sharing your own, right? Feeling connected. expressing gratitude as a form of appreciation to people helping and protecting others, right? Instead of just assumptions, but again, being intentional with expressing gratitude. Checking in on people, right? Finding unique ways to stay connected with them. And we certainly had to be creative the last 2 years to build supports in our lives, but many people felt socially isolated and an increase in loneliness as well the last 2 years. So we, again, as we begin to recover from the pandemic, what are ways that we're intentional about connecting? And again, the work with youth, inquiring often what someone needs, wants, or thinks. I think this is an important one too, is to avoid assumptions, right? What was a need yesterday or last week? Checking in regularly is important. So I think we're going to move to breakout rooms again.
Oh yes, one more breakout room for today. We're being very quick and intentional, and I like that terminology of intentional and helping people feel like they belong in very clear, explicit ways. So this prompt is such that we want to ask you, how do we improve mattering or a sense of mattering in our UNE community or in the community or setting that you work in or play in other places? And what resources and attitudes do we need to accomplish these goals? And, you know, it may seem like a small topic, but we don't do this in a way where people feel included in ways that clearly with the issues we have with substance use, with suicide, with, you know, depression, with mental health issues, but even besides mental health issues, just a sense of being part of your community is really critical to optimal wellness. And so those two questions we'd really like your team to consider. And again, Chris, 10 minutes for this.
Yep, 10 minutes.
Yep, and then we will check back in. So welcome back, everybody. Nice to see everybody here. Boy, we had a robust discussion. I'd love to hear what other folks have to say and what came from your, how do we improve a sense of mattering? And what resources do we need to do that? So who would love to jump in? Let's see. I have something from Hannah, but I think that, was that previously Hannah, or was that one you just added?
I just added it. We talked a lot about like validating others, just like we talked about before, and that like the cycle of appreciation will either like be returned to you or continue onwards and then eventually return back to you. So just acknowledging that that's important can help spread that to others and then to be returned to you. And then we also talked about like on the last part of our conversation about communication and how different it is to reach out to someone individually versus like a group. And like we shared some of our personal stories related to that, and like how, especially with like social media and texting and being behind like a screen, like we don't really know how others are portraying what they're saying. And if we reach out to a group, that others might think that someone else is going to respond, but then it's forgotten. And then you're left kind of feeling like you don't matter and that your efforts for reaching out were to no use. And so then you kind of like retreat back on yourself. But then if you reach out to the same individuals separately, then they'll respond back pretty quickly. So just keeping that in mind, that sometimes people need that little extra push of reaching out individually, and then they validated too that they matter, that you reached out to them directly.
Those are really great points. I know Brene Brown talks a lot about validation, and I think we've been talking about the importance of feeling like you have an impact, and also the point of following up on promises or recommendations that are made. I see, Lavesta, you have a very interesting suggestion in the chat about the possible benefit of having more time to stay on Zoom after classes to socialize with your peers. Would you like to say more about that? Hi, welcome.
Hey, I think that sums up most of that as far as like just losing that bit of actually connecting with your classmates is a huge difference. Yeah, and yeah, feeling a part of something when we just click on the screen and we click off when it's done. There's a difference. There was something I was like, oh, if she calls on me, I'm gonna, I'm gonna say these other things that were said in the group, but no, I'm losing it. We also talked about social media. We talked about how it could be beneficial. How could it be used, as a beneficial thing to bring people together, and for people to find people that are like them, especially in rural places in Maine. That can be difficult to feel like you don't matter, like you're alone. So ways that it can be helpful to not just focus on all the harmful things, because it's easy to do. So that was part of what we talked about.
Do you think that, and I'm not focusing just on you for this answer, but do you think the fact that we now have sort of a virtual world of learning, of pedagogy that we didn't have as much prior to 2020. Do you think that's helped with people feeling socially connected by virtue of being able to reach out and to be part of social media? Or do you think there's some hampering because we don't have, like, we're all in a classroom and afterwards just hanging out and, sharing stories?
Yeah, I mean, I think with our first group, I kind of asked that same question, like, do you think social media has those validating things, like all the likes of the different things that are supposed to, be validating? And I kind of posed the question, like, do you feel like that is actually helping people matter? Feel like they matter? And the response I got was no. So I don't know if that answers what you were just posing, but yeah.
Yeah, I don't have a specific answer to that. I was just curious because.
But yeah, the wondering about is that actually connecting us?
Right, exactly. There's a comment in the chat that Michelle pointed out, creating more space to cultivate mattering, that having explicit, specific, intentional spaces for people to gather, or whether they're virtual or in real time, to think about how do you cultivate that validation and how do you think about that. Sarah and I were talking quite a lot about the whole notion of individual self-care and how that in and of itself sometimes feels very invalidating. In other words, that, it puts almost more burden on individuals to figure out how to do self-care and figure out how to help themselves be resilient, rather than looking at the larger environment of, how the environment can support that cultivating of space that's mattering. And Sarah and I specifically, we were talking about raising kids and how, we're always told, well, you need to find time for yourself. And when people say that, sometimes you want to just, Michelle, can you relate? Sarah, did you want to say anything else about that?
Yeah, I do think that that's a challenge. And I think also telling students that they need to fit in self-care without structurally changing the way that's going to fit in their life adds a negative connotation. I mean, in social work, we go over that that's an ethical guideline, but it also seems like something we can get to later. And as students, that that may not be the best path forward as we build knowledge and practice.
Thank you. Kelsey, you've got another wonderful comment in the chat about representation and honoring the lived experiences of others. can you share what you talked about in your group?
Sure. So I think, we live in Maine. We know what the makeup is in Maine. And sometimes I feel like young people especially don't see themselves represented in social systems or education or, even recreation. So I think having people that mirror what they look like, what they value, what they honor, and also, the lived experience, and kind of not dismissing that, not generalizing it, but honoring that that's that individual's perspective that affects how they view the world. We also talked about the impact of rural communities in Maine and how, and especially in schools, that's where most children or hopefully feel safe and secure, to feel seen and heard. But if a rural school doesn't have the resources, the staff, the ability to staff a club after school, or even the values of that club that they're staffing, that child might not feel like they matter in their community, and therefore generalize that to the state, the nation, and the world.
Thank you so much. So I see I've already overstepped the time, so I'm going to pass it back to you, Kini.
Thank you. So I'm really grateful for the conversation. So this is a statement, a wonderful quote by Dr. Bruce Perry, and he's a psychiatrist from Texas who does work in neuroscience work in early trauma. And he speaks to us about the importance of relationships matter. And he reminds us that people, not programs, change people. So my ending slide with you today is really impactful quote. I think that it's really about social connectedness, being authentic, right? We don't need another program to fix, for many, their well-being. Just how can we connect as a community, as a society? So I welcome any questions that you might have.
And if there aren't specific questions, just comments are fine too.
Mm-hmm.
Can you expand on the idea of harm reduction and how mattering can impact people that way?
Were you speaking to me? I think you said, yes, thank you. So again, like what are strategies? What are systems? What are ways to connect in community so we decrease risk later? And again, just being intentional, whether it's one-on-one positive relationships, where we set up environments, right, where we can access connections, whether it's at school, whether it's in community. Again, not recognizing that we don't have the connections because of our virtual world. So how can we be intentional in other ways through harm reduction strategies to have relationships in community through sports, as an example, theater, the arts. So what are intentional systems that we put into place for youth or even adults to be able to access in support of their well-being?
Seems to me that that would tie into stigma as well.
Absolutely. Right. Yeah. The judgment and shaming for sure.
I feel like it was mentioned at one point, like about vulnerability, and that I feel like for me, being vulnerable with people has what cultivated a lot of my connections, and that people feel like, oh, like she's gone through something similar to me. And so being open about that, like, also helps others so that they don't feel alone. So yeah, I guess just being okay with being vulnerable, and it doesn't make you weak. It really actually helps strengthen you and those around you.
Thank you, Hannah. I think that's a really important point, that resilience and mattering isn't a just forward, I'm gonna just move ahead and adapt and pivot and all those words that are out there. But it is, I'm gonna move forward and I'm gonna adapt and I'm gonna do the best I can, but I'm also gonna be okay if I make a mistake. I'm also gonna be okay and ask for help. I think a big part of it is about being able to tell stories, being able to tell your story of vulnerability and seeing who else connects with it, so that you're part of a greater whole and you're not alone. And that, I think that links to harm reduction, because loneliness and feeling separate often people turn to things that are not as healthy as they could be, and then they get themselves into trouble because that's what happens with addiction. So do we want to, the opposite of addiction is connection. Thank you, Chris. One of my favorite slogans. So do we want to move on to, Kini, do you want to tell us about MRBN and how people can join up?
Yeah, thank you. I can do that here in community if I may, or I'll share my screen. Oops, sorry. So we at the Maine Resilience Building Network, we are a statewide nonprofit, and there's many ways to engage. You can visit us at our website, maineresilience.org. You can sign up for our newsletter, which brings you up-to-date information that's happening monthly and in the future. We do provide opportunities to gather through learning circles, and we have one starting on social connectedness in community resilience at the end of the month of April. And then our community gathering for mattering will happen, be initiated in early May. And those will be monthly conversations. There are no charge, and there's no membership involved. You can just show up. It's kind of a lunch and learn. We're hoping to keep them to 45 minutes. In addition to that, we do meet 4 or 5 times a year as a network, and we typically have between 60 and 80 people that gather to share. We use breakout rooms. MRBN brings us up to date on what's happening within the organization and around the state. And then we're intentional with professional development and opportunities to hear and learn from other programs and best practices in the state. And there are also no charge, no pressure to attend. You can attend one or none or all 5 or 6 of them. May 5th is the next one, and we will be hearing about some incredible programming that's happening around youth mattering in the state. Really impactful work that's already starting on this initiative. In April of next year, we'll be having our in-person conference, hopefully in April, and more information will come on that. And we're bringing in speakers and be working within communities on how we can address community resilience. So we welcome a cross-sector of individuals to join MRBN and gather and learn from one another. And I welcome all of you to consider participating. Thank you.
So we just want to remind folks that some of the conversation we've had today could be very personal and may stir up feelings that you may want to check out. And if it's something where you need some counseling assistance, here is the information for counseling services at UNE.
Our final slide.
Yeah.
You're in control. We
and
want
thank you for inviting me to be here today. Thank you.
Well, we are delighted that you were here with us. And we just want to remind folks that our poster session is April 27th. It's going to be amazing. I know we say amazing a lot about our students, but this has to be one of the most powerful bunch of posters we've seen. And we're encouraging our students to also submit their posters as abstracts for the National Nexus Summit conference as well. And I just want to end on a note that April is National Interprofessional Practice Month. So please connect with someone outside of your profession and get to know each other and learn what each other does. Thank you so much. Thank you, Kini, for being here. It's been a really great session. We really appreciate it.
Thank you.